I'm Fauze Maluf-Filho, Director of the Endoscopy Unit of the Institute of Cancer of São Paulo University, and today it's my pleasure and privilege to interview my colleague, Dr. Marcelo Simas Lima, who is Associate of the Endoscopy Unit of the Institute of Cancer, and he authored the study entitled Double Tube Endoscopic Vacuum Therapy for Treatment of Upper GI Leaks, Fistulas and Perforation. This study was recently accepted by the journal Endoscopy. And this study was developed at the Institute of Cancer of São Paulo University in collaboration with Professor Klaus Monkmiller. Marcelo, welcome.
Thank you. It's an honor to have our scientific contribution accepted by such a prestigious journal as Endoscopy. Thank you.
It's great. I have a few questions for you, Marcelo. And the first one is, what was your motivation to do this study?
Well, our first case back in 2017 was a patient submitted to an esophageal ESD because of his second squamous cell carcinoma. Previously had a jaw squamous cell carcinoma treated by radiotherapy. 2 weeks after his ESD, he was admitted to emergency room with septic complications. An endoscopy examination showed a small esophageal perforation with a large intestinal cavity. We decided to perform the modified vacuum therapy with the tube method. But he had such a surprisingly good response, and within a few hours he was feeling so much better that the thoracic surgeons called off his surgery. And I never sympathized with the idea of dilating the transmural defect to position polyurethane sponges inside the cavity. You can watch this video. We published it in the endoscopy video, and you can check it out. It's a small defect on the esophageal wall with a large cavity behind. And pediatric surgeons have been using double tubes during preoperative management of newborns with esophageal atresia for a long time to assure good upper pouch drainage and avoid aspiration pneumonia. In 2017, there were red papers asking for development of easier techniques because of troublesome positioning sponges. And as our approach showed a great initial result, we decided to start this study.
Oh, that's great. And what was the outcome of your study? Could you summarize the outcome of the study and why you consider the results important?
Well, using this technique, we found good results, similar to those of traditional sponge-based endoscopic vacuum therapy. And it's a technique very easy to install. It may also be cheaper, done with less endoscopic sections, and for sure with widely available materials.
And Marcelo, how do you foresee the next steps in endoscopic vacuum therapy? What are the developments that you foresee for this technique?
Well, there are various possibilities for further technical development. I would cite 4. First, we are expanding the technique for colorectal fistulas. We published a video, endoscopy video, showing the closure of a colorectal bladder fistula. Second is the need of specific electronic pumps dedicated to endoscopic vacuum therapy, which allows suctioning and irrigation too, leaving self-made adaptations to history. Third, I would say to investigate which is the best solution for irrigation. We use a 3% hydroxyperoxide, but polyoxygenated betaine and saline solution are validated options from wound vacuum therapy. And finally, the fourth, I would say we need research to validate the prophylactic vacuum therapy using the tube-in-tube method which will not require irrigation, but would demand a multi-center study to gather a number of patients, significant number of patients to prove it works.
So, thank you, Marcelo, and congratulations once again for this relevant contribution.
Thank you.